Hello, everyone. My name is Dr. Heather Vandergeest, and I'm a naturopathic physician here in Vancouver. It's my pleasure to be part of this Health Run Summit, and I have two presentations for you on here. My first one is how can naturopathic medicine help runners treat or prevent injury? As I said, I'm a naturopathic doctor, and this webinar is going to go through just our 6 principles of naturopathic medicine and some of the other tools and treatments that we use to help athletes. And that's a main area of my practice is in pain management. And I'm really excited to give this presentation today. So who am I? As I said, I'm Dr. Heather Vandergeest. I have a focus in my practice in pain and injury management, as well as physical medicine that includes osseous manipulation or adjustments. I do a lot of regenerative injection therapies, which I'll go into more in my presentation, both in the next presentation I actually give. I focus a lot on health optimization, digestive issues, and clinical nutrition. Disease prevention, detox and drainage, immune health, diabetes management, and weight management. So all of these things actually tie in together very well, because if there is an injury or if we're trying to stay healthy in regard to training for our sport, all of these different areas play a part in that, because if we're not eating the proper nutrition and not getting the right nutrients in our body, our cells don't have that the necessary nutrients in order to heal. So as I said, I use physical adjustments as a modality or treatment option. I use acupuncture, a lot of IV vitamins and minerals and nutrients. I also do a lot of nutrition counseling for athletes and those weekend warriors. And I also use botanical medicine and supplements. And I do hold my prescription license in case a prescription is needed. So in regard to naturopathic pain management, some of the modalities that are used can be trigger point injections into an area of tight muscle. As I said, acupuncture, dry needling, manipulation, some soft tissue work, because sometimes it's just a matter of the muscle being bunched that we need to allow it to release, and then my regenerative injection therapies. So what is naturopathic medicine? So naturopathic doctors are trained to recognize and diagnose diseases and health conditions, conduct diagnostic physical exams, which is especially important if there is an athlete coming in with an injury, specifically running in this case. We're really looking at trying to get to the specific goals for that patient of what they want to achieve. And we're able to really look at that big picture. We have longer appointments. So our first appointment is usually an hour long, and we're looking to find those links between all the different systems of the body, not just stopping at where that injury or pain is. So we really try to create an individualized treatment plan, and it's made for your specific unique needs. As I said, we do a lot in regard to nutritional modification, botanical medicine, supplements, lifestyle changes, acupuncture, IV therapy, and regenerative injection therapies. And we're always aiming to try and treat the root cause of the injury or health issue and treat the person as a whole. So the principles of naturopathic medicine that I'm going to go through are right here. So first, do no harm, the healing power of nature, identifying and treating the root cause of the issue that somebody's coming in with, doctor as teacher, which is one of my favorites because it's about educating the patient on what they can do outside of our office for the other hours and days of the week. In between appointments with us. So it's really giving the patient the ability to actually take care of their own health. We also do health promotion in regard to the best prevention, and again, treating the whole person. So it's with naturopathic medicine, it's not just a quick fix. It does take time and effort on both the doctor's part and the patient's part. And you'll know that from with running as well. You know, you don't just strap on your runners and you're able to like run a marathon. You need to train, and it does take work. And it takes work in all areas of your life, both mentally, physically, emotionally. You got to have good nutrition. You need to make sure that you're stretching. That's where the movement patterns comes in. And you're also getting good sleep. And stress and hormone balance is also important. So again, we try to treat the root cause, and that also includes decreasing inflammation. Inflammation is what actually is that pain signal, or what causes that pain. And we're always looking to try and help the body to heal itself and stay healthy. So while we're training with the activities that we enjoy, and making sure that we improve our movement and also prevent or delay the need for surgery if an injury does come down to that. So now we'll go into the 6 principles to stay healthy and keep sustainable running. So first, do no harm. It's really, we're looking at trying to choose the simplest, most non-invasive, and least toxic treatment for each patient. There is a principle that states that the simplest explanation with the least complexity and the number of assumptions is the most likely to be the correct one. So start simple with any kind of treatment and then move up. It also allows us to move up in treatments and make sure that we're not missing any steps. As I said, start simple. Before jumping right into surgery, I do always suggest look at all of your options that you have in regard to your injury. It's your body, and you need to make the decision that's right for you. For some people, that may be surgery. For other people, it may be seeing a naturopathic doctor, looking at trying to get nutrition in balance, stress, sleep maintenance in balance, and also maybe going to a regenerative injection therapy. So we want to make sure that we're covering our basis in regard to mechanical and the chemical stresses on the body and try to alleviate those. So recognizing that when we're adding things to the system for a treatment, such as prescription medication or a brace for an ankle or a knee, or even the need for surgery, we're also introducing other side effects into that as well. So again, it is really important to make sure that you know all of your options, and that's what I'm here to present in this lecture, as well as my next one that I have on this Run Health Summit. So we really want to decrease the negative side effects. There is always some side effects no matter what you choose, but educating yourself on what's best for you. And going from the least invasive to the most invasive approach. In regard to the healing power of nature, our body is built to recognize and be able to heal itself if given the right resources. But if it's not given those resources, it doesn't actually have those ingredients or pieces to it in order to heal. So the body will heal itself, but there's not always many things that can speed up the healing in some cases, but there are definitely things that can hinder or slow down your healing process. And that's what we're trying to avoid. Pain education and pain management are so important, and they really provide the guidance and reassurance for that patient that they are on the right treatment path. Injuries often occur when we're not, or like when we fail or not notice or pay attention to the messages that our body is telling us. So whether that be pain or feeling of tightness, those are all signs from the body that something is needing to shift. And it's when we're not listening to those, and I'm guilty of it myself, that's when we get into more stress on the body and tissue damage or injury. The healing process is not simple, like I said before, but it is really important to take that necessary time to heal. Otherwise, it can really slow down the process and you're out even longer than was first intended. Very often runners will try every treatment method out there that exists, but sometimes when I've seen patients, the only thing that they haven't tried is actually resting. So they've tried a brace, they've tried medication, they've tried physio, chiropractor, they may have seen another naturopathic doctor, but sometimes it's just about giving the body the rest that it needs. And that's not the case for everyone. And that's why in naturopathic medicine, we're really looking to try and make an individualized treatment plan that's right for you. There are so many options, and in like where I focus in naturopathic medicine is in the regenerative injection therapies, and that can help prevent or delay the need for surgery and at least minimize the pain that somebody is feeling. Again, we really try to identify and treat the root cause of the issue. Sometimes where somebody's feeling the pain is not actually where the root of the issue is, but that's that secondary issue that's come up that's masking or taking more of the burden for where the pain or injury or like crack in like the chain is happening. So identifying and really getting to the root cause of the issue. How we run can play the biggest role in how we feel and the generation of aches and pains, including injury. So a close look at somebody's running stride can be one of the most important aspects for injury treatment and also prevention of injury. So when I say that, I mean that the majority of running issues or injuries are actually impacted by like an overstriding. So when that foot and that leg is landing too far in front of the body, and that can lead to plantar foot pain, it can lead to lower leg pain or Achilles pain, and even up into the hip or like hamstring and low back pain as well. So addressing actually the patient's running stride is an important component to help preventing injury, and it's often overlooked. And it's something that I think not only needs to be addressed at the beginning, but it needs to be addressed early and it needs to be addressed often. And I know the clinicians that are on this health summit, most of us have met, and we have a very like similar approach to really trying to treat that root cause and really help patients every step of the way with their running careers. So as I said, it's easy to get stuck in the symptom treatment, like a sore foot needs to be iced or heat or massaged. But we also need to look further either up or down the kinetic chain of the body to see if there maybe is something else that's out of balance, which is causing more stress in that area, which is then causing the pain. So with that, I mean, we run with both legs, and quite often we the push-off deficit in one leg actually creates excessive landing stress on the other leg. So even if there's pain in one leg, we also need to be looking at what the hips are doing, the ankles, the feet, and even the other leg. It's also important to change up like exercise and intensity, and we don't want to get into kind of that like only one type of training. It's really important to kind of keep the body in a state of continuing to move in different ways so that there isn't that overloading stress or overworking stress. Doctor as teacher, which is one of my favorite principles, and it's really about educating the patient in their personal health management and empowering patients to be able to take the responsibility for their own health. So sometimes an injury opportunity is also a learning opportunity in regard to how it happened or the history, the habits, and if there's been any like sensitivity. Other than a fall, most injuries are actually the result of like how we run. So our posture, different movements, and those injury setbacks and challenges should be used as a tool for learning how to run more efficiently, working on training balance, and also just knowing your own body and your own habits. And that's what a skilled practitioner is there to help you with wherever you are on that journey. In regard to prevention, I mean, that's always best to prevent the injury before it happens. But sometimes we don't actually take a look at the habits that are actually forming that injury until it is an injury. So I do always recommend prevention, if possible, to just have a coach look at your running stride, or to have a chiropractor or a naturopathic doctor looking at making sure that your hips are level. If you need any type of like brace or orthotic, these are all things that play into helping prevent injuries in the first place. And as I said, the training monotony of that, it's the leading cause of that overtraining syndrome, and the body needs diversification in the training in order to just kind of be using different actions and not just doing the same motion over and over again. A classic example of that is I used to race on the Canadian national rowing team, and rowing is a very repetitive sport. So even in regard to my cross training, I would swim, I would run, I would lift weights using all different motions rather than that linear motion. And that helps to prevent injury and make you stronger overall. So in addition to the types of running or balancing volume and intensity, rest is also a vital part of prevention and recovery. We really need to make sure that that's also part of our training program, is the rest portion, because it's so important to allow the body to recover so that it is healed up for that next training day. And again, treating the whole person. So this is where nutrition, lifestyle, physical, mental, and emotional well-being play in. Also, just the environment, social factors, and your genetics. These all play a role in a person's life, and they all need to be taken into account when it comes to treating anybody, whether it be for an injury or prevention. When we're looking at a holistic approach, we need to take everything in that kinetic chain or throughout the body, from our feet and our ankles all the way up through our knees, our hips, our lower back, and even how our upper body is responding to that running. And all of these need to be taken into account to make sure that there isn't a weak link in that chain, which is causing an injury somewhere else. So if you think about it, a running injury is actually a misuse of our energy. For various reasons, the energy should be used to propel ourselves forward, but it's being absorbed in an area of the body that over time can't take all of that load that it's experiencing, and that's where we come into an injury. So we want to relieve the injury pain, but we want to do it in a way that's sustainable and not just masking the symptoms, but actually treating the root cause. This is how I like to look at, this is called our therapeutic order. And this is looking at trying to treat from the least invasive to the most invasive. So really establishing that foundation of health, that's really the prevention aspect. If there is an injury, allowing the body to stimulate its own resources to help healing. And then we get into supporting those weakened systems. So an area that is kind of that break in the chain of the body that is causing that injury. Then next is when I would start to prescribe maybe a supplement or things to just help promote the healing aspect of the body. Different vitamins can also be very helpful. Then we go into replacement therapies. So that may be IV therapy, using vitamins and nutrients into the body to really get into the bloodstream and help all of the cells heal and be able to work efficiently to help in that healing process. Then also in the replacement therapy, that's where I'd also add the regenerative injection therapies, which I will talk about further, but it's an injection of a dextrose or sugar solution called prolotherapy, or PRP, which stands for platelet-rich therapy, which is actually using the patient's own platelets, which have many different growth factors, stem cells, white blood cells to help in the healing process. Then I go to drug therapy, so that's when I'd be using a pain-relieving medication if needed, and then the very last option would be surgery. So I I can't stress this enough. Make sure that you look at all the different options for your own health and your own body. And if surgery is one of those options, then you know that you've made the decision that was right for you. So now just going into the naturopathic therapies. As I mentioned these at the beginning, I will go into them a little bit more. So the physical medicine side is using adjustments like a chiropractor would. We are trained in chiropractic adjustments as a naturopathic doctor in BC. Not all naturopathic doctors do adjustments as part of their practice. And it is something that, yeah, you can always search out somebody that, that does them or has the tools and treatments that you're looking for. So it's really just trying to correct stress or malalignment, whether it be in muscles, connective tissue, or the skeletal system. Also using acupuncture can be great. Dry needling is great for kind of getting into those trigger points of muscles. A lot of physios or chiropractors or kinesiologists will use that as well, and naturopathic doctors included. One of my favorites is also IV therapy. And IV therapy is the injection of vitamins and minerals directly into the bloodstream for greater absorption of those nutrients into the cell. So it's actually bypassing the digestive system and giving those nutrients right to the cell so that they are able to function optimally to help your body heal. There's a lot more absorption and amount absorbed into the body when we give it through an IV. And it can help just in getting that injury to start that recovery process. It's not a cure for any injury. It doesn't always help with a faster recovery, but it can help recover faster if you're actually absorbing the nutrients you need. IVs usually contain just our regular vitamins and minerals. So vitamin C, a B complex or other B vitamins, calcium, magnesium, selenium and zinc, and then also amino acids, which are those building blocks of the proteins, which can really help when there is an injury. Nutrition. Nutrition is key for any type of training that we do and injury that we have. So whether it be like a bone broth or other supplements or food is the best way to get the nutrition, and then to supplement if you're not able to get it through your diet. Botanical medicine and supplementation, there's different qualities of supplements. So I really suggest talking to a professional that's able to get you a good quality brand of the supplements so that you're making sure that you're getting optimal amounts. And then in regard to the regenerative injection therapies, it really helps the body to assist in that healing process and start that healing cascade. So it's an injection of dextrose, which is a sugar solution, and procaine, which is an anesthetic. And that together makes the prolotherapy. And then if we are using platelets from the patient's own blood, that's called PRP, or platelet-rich plasma. And that's going to promote the activity of white blood cells, growth factors, other stem cells, and platelets that are needed for cellular healing and recovery. And you can actually promote that healing in a body area for both acute and chronic pain or injury. So that concludes my naturopathic lecture for this Vancouver Run Summit. If you have any questions, please reach out to me. I'd be happy to answer them. And again, thanks for watching.